Safety of high volume or large volume liposuction and aesthetic surgery. So I'm currently in the process of publishing my data over 500 patients, high volume. You'll see that the outcomes were very safe. It can be done, but you have to follow certain guidelines or criteria to make sure that it can be done safely. The role of TXA, tranexamic acid, in plastic surgery. So this is an old drug. It's been around for a while. It helps prevent bleeding. I give it IV right before each surgery. Some surgeons mix it with a tumescent. There's no consensus on what the exact way or proper administration is, but in general, most surgeons use it. It's a good thing to use. Does getting plastic surgery mean you don't love yourself? I think it's a great question. It's actually the opposite. I think people who love themselves and are confident sometimes go in because they want to have a change or they want to enhance something. Now, there's an important distinction. If you don't love yourself before surgery, you're definitely not going to love yourself after surgery. Healing from liposuction, what is normal? I would say there's a range. Most patients are off of work for 2 weeks. The first 2 to 3 days are hard. At a week, you're so-so. At 2 weeks, you're functional, back to work, back to gym, but the total recovery is 3 to 6 months. So here's a great question. Talk about the mental stuff that no one talks about post-op. I think that every person's going to be very different, but you do see a lot of psychological effects post-op. And what's very common is someone does a surgery, there might be some remorse, there might be some regret in the beginning because I think there's a lot of trauma, they're on meds, and as time goes on, they usually feel better about the process. And it's not just a physical change, it is also emotional and psychological. And by the time they get to the 2-3 months mark, they kind of equilibrate or balance out. Can movement improve your scar strength? So in general, a scar heals over time, and as time goes on, it gets stronger. In the beginning, you want to avoid heavy movement like 20-30 pounds because it puts tension and strain on a scar, which could lead to an unsightly scar. However, normal range of motion is critical and necessary to prevent blood clots. It helps with breathing, it helps with pain. So I think the take home is you have to be ambulatory, move around, but you have to be mindful not to do anything excessive or strenuous could affect the healing process. When should you do a tummy tuck? It's a real personal question, and I think the simplest way to think about it is that if you have weight loss history, kids, and you have loose skin, and you want the loose skin gone, and you want to look like you've been pulled, you do a tummy tuck. If you do lipo alone with skin tightening technology, it'll help, but it won't correct the problem. So basically ask yourself, okay, do I want the loose skin gone, or am I just looking to be flatter? Because you can get flatter with the lipo, but if you're doing lipo and you have loose skin before the surgery, you will still have loose skin after the surgery with liposuction. Can you avoid seromas with a tummy tuck? So we do things to avoid seromas. We leave drains in, sometimes we do what's called progressive tension sutures, but ultimately there's always going to be a risk of seroma, and the risk is very low, 1 to 3%, but it's impossible to completely avoid it. When am I done healing after surgery? It's a broad question because most of the healing process will occur within 3 months, but there is still some residual stuff that happens between 3 and 6. It's not uncommon for example, a breast augmentation to say at 10 months I have breast pain. So the point of it is that most of it's done within 3 to 6 months, but there could be some random residual symptoms that are not problematic that do come up from time to time after the 6-month mark. Is how do I pick someone, and why is it important to feel comfortable with someone? So I think, everyone's going to have different criteria for picking surgeons, but in general, I think that you need to feel comfortable with a person. You need to have good rapport. At the bare minimum, they should be credentialed, board-certified plastic surgeons. Assuming they're board-certified, you see their results, you feel like you have a good connection or rapport with them, I'd say go for it. I think the one that's most overlooked might be rapport or connection. I do think it's important, like any relationship, that you just get along, that you feel a vibe or a connection with that person, because ultimately, I joke around with my patients, I tell them we're going to be married for a while, so we got to get along with each other, so you got to make sure you vibe well with them. Do you need to use mesh when performing a tummy tuck to fix the diastasis? The answer is no. It's not standard of care. We usually do application with sutures, with stitches. We bring the muscle back together. You can't go to the bathroom after surgery. What do you do? So narcotics, can cause constipation post-surgery. Also lack of mobility, like if you're just laying down, you're not moving around, that could also lead to constipation. So if you're experiencing symptoms like pain or discomfort, call your doctor. Usually I prescribe all my patients Colace stool softeners. They all get that ahead of time. For most people that works. For some patients it may not work, and then we have to come up with plan B, plan C, which could be other laxatives or potentially a fleet enema. Safe gluteal fat grafting. So basically they're asking, how do you do it safely? It's very simple. You stay above the muscle or below the skin. It's called the subcutaneous space or subcutaneous compartment. As long as you keep fat there, it's going to be very safe. If fat is injected in the muscle, it can get into a vein, it'll siphon into a vessel, it'll embolize or travel to the lungs, and that's how patients have died from the procedure. Cannula size and survival. I think there's a lot of literature and data showing small cannula versus large cannula. I think a lot of it depends on whether you're doing small volume enhancements or large volume. BBLs are considered large volume enhancements. So basically one of the principles is whatever size you're removing the fat with, you should inject with the same size. So I typically use anywhere from a 3 or 4 millimeter to extract or remove fat, and I re-inject with a 4 millimeter cannula. Can you get pregnant after a tummy tuck? Of course you can get pregnant after a tummy tuck. A tummy tuck is just cutting out skin or removing skin, but I think more of what the question is guided towards is what happens when you get pregnant. So if you get pregnant, the child inside in the uterus is going to expand, stretch out the fascia, stretch out the muscle again. So basically it'll undo the muscle repair or plication that took place during the tummy tuck. It's not a problem, there's no harm. You simply are going to be re-expanded from having that child. Thanks so much for watching. If you enjoyed the video, drop us a comment, give us a like, subscribe. I'll see you in the next one.